It was 1 year ago this month that we learned that nearly 24 patients at the Tri-County Spinal Care Center in North Charleston were infected with hepatitis B. News 2 Larry Collins investigates.
It all started in May of last year with 3 patients at Tri-County Spinal Care Center in North Charleston testing positive for hepatitis B. In the months to come, 22 would test positive. Attorney for several of those people, Peter McGrath.
All of these infections could have been prevented had they had the proper safety precautions in place.
Lawyers cite a Department of Health and Environmental Control investigation done after the first reported cases. We also looked to that report. DHEC found, quote, lapses in safe injection practices. They mainly surround what DHEC calls poor record keeping, including records on safe injection training and observations, equipment, medication and medication supply, room cleaning, and written infection control and blood-borne pathogen exposure policies. The attorney for the Spinal Care Center sent us a written statement saying in part, the investigation is now over and DHEC has withdrawn its earlier public health order regarding Tri-County. There were some minor paperwork errors that were corrected, and Tri-County has worked from day one to cooperate with DHEC and to ensure that its patients are safe. And according to DHEC records, almost a year later, there are still hundreds of people who are at risk who have not been tested. It looks something like this. There are 534 people identified as being at risk. 165 have already been tested. That leaves 369 people still out there needing to be tested, possibly positive. McGrath Law Firm currently has 4 clients who are patients who tested positive for hepatitis B. We are told 2 of those patients are doing better. 2 are still very ill. News 2 has also obtained the South Carolina Board of Medical Examiner records about one of the doctors at the facility, Dr. Richard Collette.
He did arrange several years ago to have his license suspended in an agreeable fashion with the South Carolina State Board of Medicine.
Records show that he admitted to diverting a pain medication and was provided treatment for opioid abuse. He was also arrested and charged with diverting a Schedule II controlled substance at a hospital in Greenville. The attorney for the Spinal Center responded, saying, quote, at the time of the initial investigation, the Board of Medical Examiners did temporarily suspend Dr. Richard Collette's medical license without a hearing. However, after a full hearing and testimony before a hearing officer appointed by the Board of Medical Examiners, Dr. Collette's suspension was lifted and his medical license reinstated. But that is still a factor that concerns attorneys for the victims.
We've seen in other places, in other facilities, that an employee or a doctor that is infected or maybe a drug user may infect the equipment and may infect their patients inadvertently because of the same equipment being reused.
But again, DHEC has not released an origin for those infections. Larry Collins, News 2.
Attorneys for the Tri-County Spinal Care Center say they are moving to have the case dismissed.